So that gives you a taste of, I suppose the important point to make is that not all evidence has to be quantitative. It's there's such a focus on positivism that everything needs to be measured but you can get so much more from actually exploring people's experiences sometimes. So I suppose from that review of all the literature that I've just summarized, there's a few key gaps that currently exist. First and foremost, there's very little information in relation to the intervention components for what people describe as forest bathing or forest therapy. So that's extremely problematic because it means that you can't replicate studies, but it also means that you can't figure out exactly what they were testing. There's also limited research with specific populations, and I work particularly in the area of mental health. And so there's a huge area there, that needs to be explored in terms of the impact on people with different psychiatric diagnoses, and people with different, shared experiences that may be outside of what's considered, kind of in normal life, for want of a better term. So the idea is that, how do you evaluate and look at how helpful is the intervention to these particular groups of people? So that can be a challenge because different psychiatric difficulties present different challenges. For example, if someone's highly anxious and you take them into a very kind of dense forest, that can actually, provoke anxiety. So we need to look at that. There is little description in relation to forest type as well in research. So one of the things that we've noticed from the work that we've done over the last few years is that different forests, different types of forests have very different health benefits, and they also impact people differently psychologically. So that's really important. There's also a limited lifespan approach. So as I mentioned, the majority of research is actually with healthy adults. And so I think it's really interesting or important to see kind of over different phases of life, how effective and how meaningful are these type of interventions to people. And then again, the majority of studies were in a very short-term follow-up. So basically there's this idea that you assess almost immediately after, or maybe even a few weeks after, but the idea is, does this intervention have an effect in the long term? Is it enduring over time? That's really important.